Okay, I think we'll begin. It's wonderful to see so many people on. My colleagues from the district, it's great to see so many faculty and staff on this call. I really do appreciate you making the time to join us. As I look outside, it's not looking very nice out there now. A few hours ago, it was looking fine. But as we look at the weather now, hopefully everyone's home and home safely. Thank you, Mrs. O'Shea, for joining me. I think you've been on every one of our community updates, and I appreciate you being here.
It's my pleasure, and welcome everyone. Thank you for joining us.
Ms. Forsberg, Ms. Burns, thank you so much for coordinating all of the behind-the-scenes technology work. I know these don't just happen, and I really appreciate you making the time this evening to put on the technical aspect of this presentation. So much has transpired since our last meeting with our community, both within the district and without. I wanted to provide you a live update this evening. I'll start just before I go into our update. I just want to start by just a quick word about my decision to go fully remote. It's my decision to go fully remote today. All the weather forecasts, I think at 4 o'clock in the morning as I'm monitoring this, me and Mr. Cole are on the phone. I'm on the phone with the highway superintendent, who's such a great resource, and on the phone with so many different colleagues in the region and forecasters trying to better understand such an uncertain weather pattern. So at 4:30 or 4 o'clock in the morning, the prediction was that our afternoon commute was going to be really, really messy and really, really dangerous. It's that first inch of snow that really scares me when you talk about school buses on some of the really narrow and windy and steep hills that we have in town. So we could have gone with an early release. I think I'm not especially fond of those unless we absolutely have to go with an early release. It creates a safety concern for a lot of families and getting the child off the bus and who's going to care for the child while I'm at work and all of those questions that come up. And we're really sensitive to that. Especially in a COVID environment. I know in years past, I would ask my neighbor or a friend, can my child stay with you? And in a COVID environment, that's not really much of an option for many people. So we thought we could maximize instruction with a fully remote day. So with 75%, I think, of our high school students remote on any given day, because you have the B cohort and the fully remote students who are remote today. The thinking is that rather than go with 17-minute periods for 100% of the population to get 25% of the population, and we can maximize our instructional day for all of our students. And same thing, this would have had an impact on the elementary schools as well, with the possible cancellation of some of the remote sessions for the hybrid students and staffing. I sent out an email yesterday with 7 more positive cases in the district, and I'll talk about that as well. But I just wanted to share a little information behind what transpired today. Out there now was a little treacherous. It was fine during the day, and it was certainly treacherous at this point. We will have our crews out salting and removing the snow so that we can welcome our students back to school tomorrow, cohort B, with Wednesday reporting. With regard to COVID updates, we saw a concerning trend in the increases of cases leading up to the December recess. That was something that was really concerning to us as a school district, as a community. I've been in contact with so many within our community with regard to the rising number of COVID cases prior to the holiday recess. With the week after and during the recess also, we saw an increase in the number of COVID cases while schools were closed. We saw an increase, and we anticipated that being the case, which is why we determined it would be most prudent to have that week immediately following the recess be a remote week of instruction. That proved that proved to be the correct choice. The number of cases that we experienced that week would have honestly put faculty and staff on quarantine for the remainder of that first week back in the following week. So we positioned ourselves to be able to stay open for the longer term. Again, as cases come in, we certainly treat every one of them very seriously. We perform the contact tracing, and if we are short on staffing, we have no other choice but to go to remote instruction in that specific school. We saw a decline in the numbers January 11th, January 18th, those 2 weeks, we did see a decline. We're starting to see the numbers creep back up. We maintain really strict protocols in our school. I think everyone, certainly our faculty and staff who are in the buildings every day, know how strict our protocols are. The masking, the 6 feet of distance, the hand sanitizing, the hand washing stations, the reduced occupancy in each of the rooms and in the buildings. We maintain really, really strict protocols, and they're proving to be effective. As we contact trace, I'm going to just repeat my encouragement that we not let our guard down. As we contact trace, we are hearing about birthday parties that individuals attended, and certainly everyone has that right. But the decisions that we ultimately make do impact the school. So we certainly have the right to socialize if we choose, but please understand those decisions do impact the school. So as we've contact traced, we've learned about sources being small gatherings, inviting one friend over to the home, and it turns out that that individual had COVID, and then it ran through the household that this individual was visiting. We hear all of those different situations when we contact trace, and it's something that we're certainly aware of. So I would just really, and then I hear stories about individuals who have not participated in any social activities at all, and who express their concern about the school closing because they have been so careful in their day-to-day interactions. So we are committed to keeping our buildings open. We acknowledge how disruptive the quarantines are. I think anyone who has been quarantined knows exactly how disruptive a quarantine is. I do want to talk a little bit about quarantines. The Westchester County Department of Health is the authority when it comes to quarantines. The school district does not quarantine individuals. We will assist the Department of Health in notifying individuals that they are required to quarantine. We'll work with the Department of Health. They are the agency that issues quarantines. They recently changed guidelines. So on January 3rd, school districts received a memo from the Westchester County Department of Health, very specifically speaking to 6 feet of distance, less than 6 feet, for 10 or more minutes, irrespective of whether masks are being worn or polycarbonate barriers are being used or any other type of PPE is being used. If it's contact for more than 10 minutes, 10 or more minutes in the aggregate over the 24-hour infectious period, and within 6 feet, the individual is being quarantined. On a school bus, the same rules apply, 6 feet, 10 minutes or more. If it's inconclusive, then we certainly do quarantine cautiously, and then we'll do some more contact tracing to determine if the contacts were in fact contacts, or if the quarantine can be lifted, and the Department of Health certainly assists in that regard. With the school buses, prior to this change in guidance, if one person was positive on a school bus, school districts were required to quarantine the entire bus. So with a school bus, a full-size school bus, it's about 35 feet in length. So you could have been 35 feet away from the individual who tested positive if they're on opposite sides of the bus. The DOH prior to January 3rd required that everyone on the bus be quarantined. And that was met with some concern, and we certainly conveyed those concerns to the contact tracers and to the Department of Health. So the guidelines now, and we're fortunate to have cameras on our buses. So we have consulted with the cameras. Now we can't get every angle to know exactly who was sitting where on the bus, but we do have some cameras on the bus that we can consult as a resource. So I did want to share that. It may seem like we're quarantining fewer people. The guidelines have been such that they're limiting the quarantines to 10 minutes, 6 feet. And rather than quarantine a full bus where somebody may have been 20, 25, 30 feet away, we're looking at a 6 foot distance between the individual who tested positive. With regard to classrooms at the elementary level, if masks are removed, and masks are removed at snack and at lunch, generally when masks are removed, the quarantine will take effect for the entire classroom. So and I'm speaking in general terms, every case is so specific and requires such careful attention. And we confer with our medical director, because even now where we've been and what we've experienced, we still come across cases that we haven't encountered, and we do consult with our medical director on each and every positive case that we're aware of. We do consult with the Department of Health as needed, especially if something that we haven't encountered comes along. With regard to the duration of quarantines, I think you're familiar that the quarantine duration was reduced from 14 calendar days to 10 calendar days. However, if there is someone in the household who tests positive, so as an example, if Mrs. O'Shea and I were in the same household, if I tested positive and Mrs. O'Shea is in the household as a student in the district, I'm theoretically contagious for 10 days. When I test positive, our medical director has shared, and I do rely heavily on our medical director who serves as our expert. Our medical director has shared that one's contagious for 10 days. So Mrs. O'Shea, unless I can completely isolate in the household, Mrs. O'Shea is being exposed to me each of the 10 days and to the virus each of the 10 days. So her quarantine, if isolation's not happening with fidelity, her quarantine theoretically begins after her last day of exposure to me, which could be on my 10th day of infectivity. So that's where this idea of 10 days plus 10 days comes in. However, please know, the Department of Health is the agency that determines quarantines. If you can provide the health office of your school with a release from quarantine, a quarantine end date from the Department of Health, we'll certainly honor that. So I just want to share that's where the 10 days plus 10 days comes in, because if you're continuously exposed to a positive person while they're contagious, your quarantine window just restarts. So I just wanted to share that. There has been some confusion around that, or some disagreement around that. Ms. O'Shea, were you going to add something?
I was just going to ask you to clarify that having a negative COVID result does not shorten your 10 or 20-day window.
Correct. Negative, and the Department of Health has been very consistent on this. A negative COVID test does not diminish the 10-day quarantine window. We've heard that and we understand that. My understanding of this all is that the incubation period is 2 to 14 days. And even a negative test on day 7 does not mean the individual won't be positive on day 8, or will continue to be negative on day 8. So I appreciate that clarification. That's a really important clarification. One of the requests that I had in my January 8th email to our school community before we reopened for in-person learning after the holiday recess was that if someone in the household is getting tested, is awaiting results, and there's a concern, whether it's exposure or illness, please keep the children home. One of the biggest sources of positive tests that we find out after the fact, and we have no way of knowing, there's not really a way of knowing that someone in the household is being tested, but what happens is someone at home is getting tested, child is sent to school, test comes back positive on the parent, we ask for the child to get tested, and then the student comes back positive. So we would just ask that everyone be mindful of that. If someone in the household is ill and being suspected of having COVID, please keep the children home. Please keep everyone home until you know that the result is negative. It's a very humble request that we're making just for the greater good of our school district. Also, the symptoms manifest themselves in different ways. So certainly speak to the doctor, speak to the pediatrician if there's any question at all, and please heed their advice. You can call our health offices in advance. Our nurses are amazing. They're just enormously talented, and at this point, their experience with COVID is just unparalleled in schools, and I really respect their opinion. So if in doubt, please reach out to the health office. It's only a phone call. Their numbers are on the website. They're very accessible, and they're just wonderful to work with. So now just to transition. So that's just an update on quarantines. I know I'm guessing there are some questions about, well, gee, we seem to quarantine, we seem to be getting some cases, but we're not closing the schools. Well, at the high school level, we do have about 44% of our students who are remote. I report cases that are remote. So if a student is remote, they may not have been in our building since October. I'm sharing it with our school community. There may be instances where an individual has been out for a week and a half because someone in the household had tested positive. And then subsequent to that, the individual in our school tests positive. I do share that. We share that information. We try to be as transparent as possible in the information. So with students being remote, with individuals being remote, we are seeing positive cases that arise. I don't think it's any implication on the school, but we are sharing that information with our school community. So I put out 7 cases yesterday to our school community. Not all of those, in fact, more than half hadn't been in our building in a couple weeks. So I just want at least a couple weeks, maybe even more. Or maybe one of those cases was a week and 3 days. So I just want to clarify that statement and qualify that statement. So contact tracing isn't always going to be necessary. We will perform the contact tracing if we determine that we don't have adequate staff to supervise the children. We will go remote. The school will go remote that day. At times we have had classes go remote. At times we have had one school go remote. We've borrowed staff from one school and we've placed them in another school. And our teaching assistants are absolutely amazing. And they have been so flexible, so responsive, so supportive, and we appreciate what terrific team players they've been. With regard to the rest of the year and planning for the rest of the year, we put out a survey on January 8th with regard to transitioning from hybrid to remote to hybrid. So it was not a formal survey, but it was essentially, please contact your school to let them know if you intend to change your model. So that was important for us for a few reasons. First, the constant in and out was becoming disruptive. It was less, our elementary numbers have been very stable. Our elementary numbers have been extraordinarily stable. Our high school numbers, we're seeing students come in, students come out. And what we needed to do was wrap our hands around the data so that we can understand what our second semester can look like. So I will share a bit about what we've learned. Our goal remains, it always will be, it always has been, to get all of our students back. I say that to you with the utmost sincerity, the utmost candor. I say that to you as a parent of 2 children who I want back in school. I have a child at Crompont and a child at Mohansick, and I make no secret of it. I'd like them back in school 5 days a week. As of right now, they're in cohort A. They're attending 2 or 3 days per week, depending on what week it is. I think that's all of our goal. I don't think I need a survey to know that that's our goal. I don't think anyone is unhashing anything that we don't already know. We want our children back in school. And I promise you, no one wants them back in school more than I do. All 3,400 of our students. And our faculty and staff and administrators want all the children back. I think that is one united agreement that we have, is that we want all of our students back in our classrooms. So I share that with you. What I will also share with you is one of the biggest barriers to preventing all of the students from coming back are the guidelines of 6 feet of space in between desks. We've removed furniture. We've deconstructed the classrooms. Our classrooms look very differently. Our teachers have done a remarkable job of still making the classroom such a welcoming place for children. But we've taken out a lot of furniture so that we can maximize desks in the classrooms. Even with that, we're still extremely limited. Part of that is space. And this is where every school district is unique. There are some school districts that have a lot of space and a lot of unused space. In 2019, when Dr. Paul Seversky conducted a capacity study for our school district, Dr. Seversky shared with us that our elementary schools are at 80 to 90% room utilization. That's a fact. It's a published study. It was presented at a board meeting. That really limits the ability. It's not so much, well, can you use space creatively? We've done that. That's how we are where we are. It's the additional space. It's the reconfiguration of space. It's new space, and my team and I are committed to working through this and bringing back as many students as possible. I'll be sharing some additional information on bringing back some additional students a little bit later in this presentation. But I want to be clear. We want our students back. I'm optimistic about the vaccine. Perhaps as the vaccine becomes more widespread, the guidelines would be reduced for the 6 feet of distancing, and that might be an avenue to return more students. I was really optimistic when I saw an article by the CDC that cited the CDC saying that all students should be back in schools. And as I read the fine print, I read back in schools with masks and appropriate social distancing. And that's something that it's just a limiting factor when you're short on space. So yes, there are some districts that have been able to return their elementary school students. I think there are about 5 or 6 of them that I'm aware of in the county, and or in Westchester and Putnam that I'm aware of, about 6, maybe 7 at this point. And I've been in communication, and I've tried to learn a little bit more about the model. And space seems to be a really important and deciding factor within the building. So we're working toward that. I just want to share with that. As a result of the survey, I'll share with you that approximately 82% of our elementary school students are learning in the hybrid model. 18% are learning remotely, fully remotely. That number really didn't change after our survey was done. So I think at Crampond, there was a net increase of 3 students remote. Brookside has a net increase of 1 student coming back into the classroom. Mohansick, I believe, has 2 students net increase into the remote plan. So the changes in model were not really a factor here. The middle school the numbers are still being finalized, and we're still looking at that to settle. High school was able to return many students. There were many students who opted to go to our fully remote platform, but many students, about 50 students or so, decided to come back into our hybrid model, and we certainly welcome them back very happily. With the numbers where they are for the second semester, we're in a position to look at the high school and say, okay, with the capacity that we have, we are going to begin a process under Mr. DeGennaro and his team's leadership. We're going to begin a process of bringing back our 9th grade special education students. So we're going to phase that in for our special education students. More information will follow, but we are going to begin that process. And when I say bring back, I'm talking about 5 days per week. We're going to begin returning some additional students. We're going to be making some additional announcements at the high school level, and we're certainly looking at additional possibilities at the middle school level as well. At the elementary school levels, we are restricted on space. We are very, very short on space. We talk about using an art room. Okay, I can put 12 students in an art room. We talk about a music room. In some of our buildings, we don't have music rooms. We're so short on space that music is happening on a stage. And that's a reality. And that's something that actually we're looking at as well, looking at how do we get more space into our buildings. That process does take time. With regard to some of the other things that I just want to share, the needs are very different of our students. I certainly acknowledge the needs of our early elementary school students. I acknowledge the needs of our upper elementary school students who are going to be transitioning into middle school next year, our middle school students, and our high school students. And the needs are just very different. They're all really, really important and all really different. The mental health needs at the high school is something that is on my mind. That's something that I've been quite focused on with our leadership team, with our clinicians, our social workers, our psychologists, and supporting our students. We had a really heartening meeting with Senator Harcum last week, Friday. And the meeting focus was on fall and winter sports. But interestingly, we had our student athletes, we had our coaches, we had some of our parents, Our athletic director, high school principal, and I were there with Senator Harcum, and our students were so amazing. They were just so amazing and so passionate, and I really admire their advocacy. They spoke for themselves. They spoke so well. They spoke articulately. They spoke so passionately. But the most interesting part is they didn't speak about athletics. This was not a meeting about athletics. That was the title on my calendar invite, but this was not about athletics. This was about their emotional well-being. This was about something to look forward to, something to keep them connected to their school. And if sports is the venue to do that, I think we can do that safely. We have the room, we have the staffing. The room it's after school. We have the staffing, we have coaches. We have the most stringent and best safety protocols around. Our doctor, Dr. Corsaro, has reviewed them, has made changes, and has really made this, I believe, the safest athletics program around. We can offer athletics and we can offer them safely. And I offered Senator Harcum, if you needed the perspective of a superintendent to endorse this, I endorse it. For me, this is not about athletics. I believe athletics are important, but the emotional well-being of our children is even more important. And that was the theme of the meeting. So I received an email asking, gee, you're really emphasizing athletics here. And if that's the takeaway from the meeting, something was sorely missed, because our students need this for so many things. And it's not just athletics. Our students need the fine and performing arts. They want to participate in their shows and in dance company. And I'm so happy that we were able to put on the fall comedy of Clue, and it was amazing. It was wonderful. Our students did such a brilliant job. And dance company, that's going on. We'll be masked 12 feet apart, great choreography to maintain the distance. I'm so proud that our students will have those opportunities in their senior year. As we look out to the spring concerts, our chorus teacher, our band teacher, our orchestra teacher, our directors of our performing arts programs have done such a remarkable job in being creative to provide our students with opportunities. Our club advisors have been so creative to keep our children connected in a virtual environment. Our students need these opportunities, and we're doing everything that we can to provide them. With every opportunity, whether it's in-person learning, which means so much to all of us, or whether it's an extracurricular program, I support bringing our students to school. But we have to have the space, we have to have the staffing, and we have to be able to honor the highest safety protocols for our students and our staff. The vaccine, I just want to talk for a moment about the vaccine. There have been questions, well, when the vaccine comes, will that change anything? I'm hopeful. I really am hopeful that the vaccine can become a little more widely available for anyone who is keeping track of the vaccines. It's really hard to access a vaccination appointment. So at this point, we're working as hard as we can with one of our local medical practices to secure vaccinations for anyone who wants them as an employee in our school district who are classified under the 1B tranche. And those have not been easy to come by. So we're working through that. We've made some progress. We have made some progress. There are individuals in our school district who have received their first dose. We have some who have actually received their second dose in our health offices specifically. And I'm optimistic. I'm hopeful. I think going into the remainder of the year, we want to keep our buildings open. We want to keep the students coming in. We're optimistic that the vaccine will become more widely available. I don't know what happens after that. I truly don't know how this pandemic will look in a month. I understand that we'd all like me to know, and we'd all like to know. Everyone wants to know how this looks. The truth of the matter is I called our medical director before I got onto this call. And I said, Doc, how does this thing look in a month? How does this look in September? And we had a great conversation. We're both confident that we'll be able to welcome our students back in September. There's a sense of optimism here. Before we get to September, we have some wonderful things that we're going to be doing for our students. Class of 2021, I see you out there. Parents of the class of 2021, I see you out there. Please know that our team is hard at work thinking about how to make this a very memorable end of year for your children. I've spoken to Chief Noble, who's terrific, and he's a terrific partner to the district and friend to the district and friend to me. And he has agreed, I don't want to give away too much, but we've agreed to have the parade again. So those conversations are happening. We're certainly sensitive to the class of 2021. They had a really difficult junior year and a difficult senior year. And we're really sensitive to our students who are going to be leaving us in June. And we are doing everything that we can. And we will continue to do everything that we can for them, as we would any of our students. End of year celebrations, there are some other milestones: 8th grade, 5th grade, 3rd grade. How do we cap this year off for the cohorts of students in a special way? Those are things that we're also continuing to plan as we navigate educating through a pandemic. We're monitoring a ton of data. We're looking at a lot of academic data. We're looking at a lot of social emotional data. We're looking at a lot of specific content area data and looking at grades and monitoring that very carefully to see where our students are. I'm pleased by what I see. I am encouraged by what I see. I think that's a testament to so many people. I think it's first and foremost to our teachers and students. They're the ones in the classrooms, and they're the ones directly with the teaching and learning, interfacing with the teaching and learning. So my hat's off to our teachers, my hat's off to our students who have been so resilient. It's so difficult to go to bed at night not knowing whether your school will be remote the following day because there were 2 COVID cases or 3 COVID cases. Everyone has been so resilient. To our parents, you've been remarkable. You have been absolutely amazing. I appreciate your patience. I thank you. I don't know if I can express my sincere thanks deep enough and sincerely enough. This has been hard on everyone. This has been so challenging. What a difficult, difficult time. There are no ways to put a nice bow on the situation that we're all facing. This is tough. This is really tough. We've come together as a community, and it's been remarkable to see that happen and to hear some of the conversations that I've had with parents. Some have really uplifted me, and some have just been so sad to hear some of the experiences. We're all here. We're here for you. We're here for your children. And please know that we're always here. With just before I close, Mrs. O'Shea, do you want to share any remarks? Is there anything that I maybe omitted that before I say my final remarks to our community?
Nothing that I think that you omitted. What I do want to reiterate, you were very clear about wanting all of our students back and sharing that our administrative team and teachers feel the same way. Having had that capacity study done in 2019 without even knowing that we had a pandemic coming, we already realized that a lot of 3 of our elementary buildings and our middle school and high school were approaching top capacity at that point in time. And we had conducted that study just for planning purposes in general. And the pandemic came and we needed to go to the hybrid model. Even with 50% of the students in the building at the time, we did not have a lot of room to grow when you're looking at 6 feet between desks. So our principals and our administrative team have walked around buildings. They have looked at square footage room by room. We've looked at spaces that haven't not traditionally been used as instructional spaces. We've taken away offices. We've done everything we can to provide greater opportunity for students. So when we think about bringing students back, we're really looking for every ounce of space. And then how do we target student groups to bring back? As Dr. Hatter said, every group is important. We have our early elementary learners, we have our special education students, we have our learners, K-12. So this is work that continues. We have been able to bring back special education students in the classes at the elementary level. We have not been successful yet in finding a way to bring in integrated co-taught elementary students. We're working on secondary now that we have. So I know it's frustrating, and it's frustrating for us as educators, but we are so bound by that 6-foot rule, and having had buildings that were so at capacity at the start of this just adds more to our dilemma.
Thank you. Thank you. So in sum, we talked a little bit about weather, and as I look at the conditions out there, I don't know if they're improving, but it's certainly cold out, and I still think I see the snow falling. We talked about quarantines and some of the changes on quarantines from the Department of Health, the different quarantines. I shared a little bit of my requests with regard to if somebody in the household is ill, please do remain home, keep the family home. That would be really, really helpful to us. If with regard to the symptoms, if somebody in the house is sick, please do consult with our health offices. The symptoms manifest themselves in different ways. We have gone through the various hybrid to remote, remote to hybrid. We're looking to bring additional students back, and we certainly will do our best to bring as many of our special education students as we can, specifically at the high school where there is a higher percentage of students who are fully remote. With regard to next year, we're absolutely looking at next year. Know that my goal coming in is to return every student to school. That's our goal. I think that's always been our goal. That will always be our goal. And that's something that we'll work toward. Before we get to that goal, there are some things that we're working on now, supporting the mental health and emotional well-being of our students. The class of 2021, I certainly see you out there, and know that we're thinking of you. And then certainly our other end of year celebrations, our other end of year items, the academic progress of our students. Those are a lot of the things that we're thinking of. With the questions, there are just some questions that I'm seeing. One of the questions is, since the beginning of the Group A students, that they haven't had a 3-day week, Group A students. I'm not quite sure. I'll have to look at the calendar to determine if that's true. My students are in Group A, so I should know the answer to. My children are in Group A, and I thought that there has been a 3-day week, but I'll certainly look at that. Are we looking at some additional special education students? I think we mentioned that. The answer is yes, we are looking at that. Emotional well-being of our elementary students, that's absolutely on our mind. I had a meeting with our clinicians at K-12, actually. So many of the programs that I spoke to at the high school level certainly are being discussed district-wide, so it's not limited to one group of students. The question here, rumors about the hybrid model continuing to next year. I appreciate not everything on social media is accurate, unfortunately. I'm not sure where the rumors originated, but in terms of rumors for the hybrid model, the reality is we don't know at this point. So one of the things that we don't know is, will the governor mandate a fully remote learning program? We don't know that. We haven't done that in the history of our school district. I can tell you, if we didn't have a remote learning program, we would have come in for an early dismissal today. It was a fully remote that I thought could maximize the instructional time. So there is benefit to the remote learning, but a lot of the decisions that we're going to make moving forward, and our fiscal year closes June 30th, new rules may be in place July 1st. We don't know if a remote plan will be required, if hybrid learning will even be permitted. Those are things that we don't know. I will tell you what our goal is, and I think it's the collective goal of everyone in the district, is we want our students back. We want all of our students back, and we want them back every day. So with regard to, I'm not quite sure where the information began with regard to the hybrid trickling into next year. I don't know if that is true. I don't know if it's not true. The goal, I will tell you, is to bring everyone in, and no one knows if it's true at this point, because there are decisions that have to be made at the state level that will determine our course of action. The question with regard to special education students returning, more information will come out on that. The short answer to the question is yes, we're looking to bring in additional special education students. We're starting at 9th grade. And that would be all special education students at 9th grade. And then we're going to determine how many additional students we can bring in beyond that. My hope is that we can go 9, 10, 11, 12 at some point. It'll be a phased in approach. But there's a little more planning that has to do before I can commit to that on this call right now, all 4 grades. So we're going to start with 9th grade, and Mr. DeGennaro and his team have been just remarkable in their work. The question is, can the younger students, elementary students, go to the high school if it's empty? The building's not empty. The building, I just want to share that we still have a couple hundred students every day, and it's increasing now. We had 50 new students sign up to come back. We have special education students who I believe need to come back into our schools, are coming back into our schools. The question is, the priority should be our younger kids, is what I'm reading on the screen, not the high schoolers. I appreciate that sentiment. The priority are all our students. I don't know if there's any one group that we're not prioritizing. We have 83% of our elementary students attending in a hybrid model, and we have fewer than that at the high school model. The question is, can we increase that? Because there are some students who really need to be in school every day. And I'd love to be able to share more. Unfortunately, I'm not permitted to share more, but we certainly have many students who need to come in additionally. The other part of it is, can you bring them over to the high school? The question is, who's supervising the elementary students at the high school? That's another question. Okay, so we can bring the students there. I need supervision, people who are trained to work with students at that age. So I just don't want to lose sight of that in the questions. With regard to sports, question is, can we, what is the plan for sports? The plan for right now, the governor has authorized local health departments to sign off on high-risk sports. So the local health departments are conferring with each other. I think Westchester, Putnam, Dutchess, and Rockland county executives are coming together, and their Department of Health are coming together so that they can determine whether they're going to permit it. If they permit it, we'll allow it, provided that the safety protocols, and they have given us some input as to some of the safety protocols and spectators, and do we allow spectators? Is it home spectators only? Do you limit it to 2 fans per home athlete? So we've had those conversations, and we've had the conversation with Senator Harcum, we've had the conversation at the county level, and we've had the conversation with our medical director, who does endorse bringing athletics back. Can the students get tested every week to allow relaxed distancing? That's not an option for us with regard to a few things. First of all, the 6 feet is the Department of Health. That's something that's beyond the school district. It's not a school district determination. Guidelines are put out, we're following the guidelines. So testing is not in lieu of. There was a time that the state education department put out masks or 6 feet. The Department of Health very quickly indicated that it needed to be both. Are we French Hill? Are we working on French Hill? Those are all parts of conversations that we're having. Everything, I think, is part of the conversation that we're having. Federal government, full-time school before September. So if the federal government makes us return to school full-time in September, what's the plan? I think we would need to see what the safety protocols are before we can tell you the plan. So if the plan is you can relax the 6 feet, I don't think they can do both. I don't think they can keep the 6 feet distance and mandate every student coming back. I don't think that's a realistic conversation, and that's something that has been indicated at the state level as well. Will everyone be required to receive the vaccine? No. They will not. First of all, for students, this vaccine is not even permitted. It's not even tested. It's not even permitted, authorized for individuals under the age of 16. That's Pfizer. Moderna's 18. I may have those mixed up, but it's certainly not anyone under 16. So no, individuals will not be required to receive the vaccine. That's a personal decision that people will make. Now, will the state mandate it? That's something that's outside of our control. We as a district will not, and I don't know of any other school districts that are mandating it. If a student gets exposed and must quarantine, even if they get a negative result, what's the point of putting the child through the barbaric test? That's a very interesting question and a good question. So if a student is exposed, we recommend a test. We recommend a test because the Department of Health recommends a test. That's been the guidance that's been issued within 5 days. And you just want to know to treat it early. You want to know because the individual may be asymptomatic and passing the virus along to more compromised individuals in the house. Immunocompromised elderly individuals. So that's, but yes, the quarantine still has to get served. I believe I've answered that. I've addressed French Hill. Dividers, plexiglass, those are all conversations, but 6 feet is still part of the conversation. So the question was, what about dividers and plexiglass and separation? Separation is the key part of that question, and it's a 6-foot separation that's required, or that's recommended by the Department of Health. And I just, with them being the authority on this and them being the experts, the Department of Health is the agency whose directive we're going to follow. Thank you. I appreciate, Kathleen, I see your comment. Thank you. I appreciate those kind words. Travel guidance, if a child's going to travel during one of the breaks. Yes, if someone's going to travel for one of the breaks, please let the health office know. We generally find out because the children tell us that they went to this wonderful place and they went on an airplane and they got to see this person. Please let us know. It really is it's the right thing to do to let us know. There's a quarantine that's in place if you travel outside of the state to a non-contiguous state. It's 3 days, and then it's actually 10 days, but you can test out. By testing negative on the 4th day, you can test out of the quarantine. So it's reduced from 10 days if you travel to 4 days, but there are all kinds of rules for that. You have to test before leaving the destination. You have to test before, after you've come back. All of that is posted onto our nurse's website, the health office website, and there's some good information there. With regard to French Hill, currently French Hill right now does not, there's no way to upgrade it to the ventilation standards that we would like. There just is no way to upgrade that facility to the ventilation standards. That is a project that is so expensive in our budget right now that it's not a feasible piece for us to facilitate, to really use that space. Can we use a few classrooms there and put 12 students here and 12 there and 12 there? Yes. That's not going to solve getting all K-5 students back into the building because we would have to use the larger spaces. So the question is, if space is a larger factor, is the district doing anything to create more space? Yes, the answer is yes. Our steering committee is looking at that. We have a district committee that has been looking at space, and we actually commissioned this study well before COVID hit us. So this study was out well prior to us even knowing anything about COVID. So we have been looking at this and we continue to look at this. It is a lengthy process. State ed approval takes a long time. The drawings, the planning, all of these steps take a really, really long time. And I just want to share that we are looking at all of those options.
And even we looked, sorry, and even Dr. Hatter, we looked at having modulars added to our elementary facilities, but that was also a very lengthy
a year out
state ed approval process because it's considered a new building. So that wouldn't work for us either.
The last question that I see here is, are students still going to receive February and April breaks? Or are they going to be learning through the breaks? No, students and staff will receive the February recess and will receive the recess. I believe it's at the end of March this year. The spring recess, I think, is March 29th. And I know that because I was working on the February and March calendars that I'm going to be, I think they're posted to the website. Ms. Forsberg, I think we posted those to the website tonight. So the February and March calendars are posted. In truth, the calendars are pretty similar to every other calendar. The only difference are the alternating Mondays. So the Mondays are there. I think we went through every single question that was posted. We took the time, and I'm happy we did take the time to hear the questions and to answer the questions. Oh, one of the questions is when graduation and prom will be and how they are going to be handled. More information will come on that. I see the question there. That's something that's really on our mind. Class of 2021 absolutely is on our mind. So more information will follow on that. I don't, similarly to last year, we were a little late in releasing our plans, but we released a comprehensive plan. It was detailed, it was thorough, and I think it was an excellent plan that we released. So I don't know when. I think we may be a little earlier in releasing, but I don't want to release any information piecemeal. Some of these dates are still being determined. So we're working through a lot of the details, but I'd like to disseminate an entire package and an entire comprehensive plan when we do that. And I think everyone will be pleased. Ron, thank you. I see your email. I think I missed a couple. Oh no, those two just came in. All right. Well, Ms. O'Shea, thank you so much. I appreciate you joining me. To our faculty and staff, thank you. I appreciate you. I hope you know how much I appreciate you. To our parents, I thank you. I thank you. I can't thank you enough. Thank you for your confidence, your support. I appreciate you attending. We had over 200 and some, I forget the number that I saw here, and then there was some watching on YouTube Live. So I really appreciate everyone's participation in this evening. We're going to get through this. I know that we will. I'm confident. We're a resilient group, and we will. And I think we're all committed to the same goal, and that's the well-being of your children, of my children. And I hope you do know that the decisions I make for your children, I make for my children too. It has to be good enough for my own, for it to be good enough for your children. So I share that with you, and I thank you. Have a good evening, and I look forward to doing another one of these presentations soon.